some of these homes on the left and the right. See this house over here on the left, and it's just gone. That's just one of 1,000, like nothing I've ever seen. I mean, it's utter devastation. It's just very overwhelming and sad. What the storm did right in the middle of downtown Mayfield was incredible. It's like a Category 5 hurricane inland.
Hi, this is Ken Marshall, the Chief Operating Officer at UofL Health. I know a lot of you this holiday season have given to the American Red Cross to help support the disaster relief efforts in Western Kentucky. Today we're in Western Kentucky. This is the operations center of the American Red Cross, and we wanted to take some time today to show you how these volunteers are helping and how your support is helping the people of Western Kentucky.
This is our operation. So it is staffed by our volunteers. Approximately 70 to 75 volunteers have traveled across the nation to be a part of this intricacy that is the machine of Red Cross. So what they do is there's anything from elected official liaisons to logistics to transportation to finance to oversight. We have a mental health team that has another wing that's not even in this room so that they can operate privately. What these people in this room do all day long is they are overseeing the 250 plus volunteers that are out on the ground, feeding people, sheltering people, showing compassion.
I can help whoever's next.
We have a recovery center established, run by caseworkers, and the objective is to open cases for folks who have sustained major or destroyed damage. So we are here to self-tailor a recovery plan. That entails long-term recovery planning. If housing could be an issue, we could provide shelter. If meals and getting meals and food, we could provide feeding. Also, long-term recovery planning would entail providing resources and referrals that could help with the housing.
A disaster, typically we have a ground zero, but in this disaster, my chapter, we have multiple grounds zero. So in every affected community is as devastating as the next community over. So it's impressive to watch Red Cross be able to put their arms around the breadth of this disaster so quickly and handle it so flawlessly.
I'm standing here in front of the Primera Iglesia Bautista Hispana. We've had a relationship through some of our local volunteer leaders with the Hispanic community, and it's important for us to ensure that we're reaching everyone that needs help and everyone that's been impacted by these disasters. We're here on the corner of 9th and Broadway in downtown Mayfield. Behind me you see is our Red Cross Emergency Aid Station. The aid station is supplied with emergency supplies and needs that folks that are involved in their recovery might need. We also have disaster mental health, disaster health services, and disaster spiritual care. And we have authorization to provide financial assistance to replace any durable medical equipment, glasses, dentures, other prescriptions that may have been missed or lost due to the disaster. You just look around at the destruction that this community has faced and the impact this community has faced and the need for that care, comfort, hope, and just love that people need during this time of deep sorrow and deep grief.
This gives you a good idea of what the Red Cross is doing here in Western Kentucky with their army of volunteers and the outreach that they're doing. As UofL Health employees, you still have an opportunity to give. We have an employee campaign going on right now. I ask that you join me in making a donation to support the American Red Cross and all the good work they're doing here to make sure that UofL Health's impact can be felt across the state.